Hello, my name is Thelma Garcia. I'm an RN BSN, currently pursuing a future as a family nurse practitioner. I'm enrolled in the nursing theory course led by Dr. Monsivais at the University of Texas at El Paso. During the next few moments, I will be discussing the future of nursing theory. We will talk about nursing as a profession and as a discipline, along with examples of theories. Lastly, we will include the impact of theory in practice. Nursing as a profession refers to a specialized field of practice founded on the theoretical structure of the science or knowledge of that discipline and accompanying practice abilities. This is the textbook definition of nursing as a profession. Honestly, I had a difficult time understanding what it was describing. Searching deeper into the introductions of nursing theory, I have gathered that nursing as a profession involves using evidence-based practice for decision making. Theories and models are used as tools to guide reasoning and find the best practices for professional nursing. An example of a theory is the Core Care Cure model by Lydia Hall. During this course, I created a poster that involves this model in relation to pressure ulcers. The concepts of the model align with nursing as a profession in the way that the concepts apply medical knowledge to treatment and prevention of pressure ulcers. There was much evidence-based practice material that helped determine the best approaches we use in practice now. Qualitative studies, observational studies, and quasi-experimental studies were found to support reasoning of best practices such as pain control, preventive practices, meeting psychological needs, and increasing prevention knowledge. Research for best practices will continue in the future as new technologies may bring forth better strategies to prevent pressure ulcers. Pressure ulcers are only one issue. This model can be incorporated with multiple, if not countless, healthcare issues. The vast number of theories give our profession unlimited research opportunities. Knowledge will continue to grow in relation to the nursing profession's goal for human betterment. As defined by Alligood, a discipline is specific to academia and refers to a branch of education, a department of learning, or a domain of knowledge. Through the readings, nursing as a discipline has the central concepts of person, environment, health, and nursing. Theories give guidance that patients are seen as a whole and not only from the physical aspect. They provide a framework that allows us to include even psychological and spiritual elements for a holistic, patient-centered approach. In the Core Care Cure model mentioned before, the core concepts are well found in the model. This theory impacts nursing as a discipline because it includes the nurse using a holistic approach by addressing all aspects. Communities of scholars associated with theory continue growing globally as societies share knowledge and address research and practice questions in conferences, on websites, in newsletters and journals. Evidence of growth may be attributed to global publications and communication, increased world travel, and translation of nursing theory textbooks into other languages. Theories will continue to expand our knowledge for many years to come, as it is widely evident that nurses are using models and theories to bring better evidence-based practice to patient care. Pandemics, climate changes, and merging of cultures will bring new challenges to the population's health, and nurses will continue to mold and adapt the theories to advocate for patients. Technology will also be integrated into these theories, as the future may bring more efficient ways to manage and treat illnesses and diseases. For the greater good, there will continue to be growth in knowledge, as we evidently experienced with the 2019 coronavirus disease outbreak. My favorite theories from what I have encountered thus far is Catherine Kolkaba. She has created an amazing webpage where she allows access to her theory and use of her guides and models. Kolkaba welcomes researchers to modify her comfort questionnaires specific to their area of research. Her theory has already guided much research in the science of nursing. Yet there is much more for us to learn and expand from the middle-range theories used today. We have talked about theories in relation to nursing as a discipline and as a profession. A few examples of theories and models were shared to attempt a better explanation of how using theories help shape the way we care for our patients. Theory has had an impact in the way that I practice. I have noticed that I approach the patient with a different view. In my reflection paper regarding theories, I explained a situation in which I encouraged a patient to achieve a holistic approach by fulfilling her need to continue working online, as it gave her a sense of purpose. She felt like a burden to her family, but they would discourage her from working. I talked to them about the reasonings of bringing a balance within all aspects of her life to achieve wellness. The patient was very pleased and stated that she was feeling better as she had something to look forward to. Lately, I even find myself trying to go find evidence-based practice articles on numerous things I find at work and see what theories have been used. I never realized theories have shaped pretty much all aspects of our practice, and as Allie Good cites at the end of her book, one thing remains true for the nursing profession. Theory without practice is empty, and practice without theory is blind.